I'm not going to belabor your time on seizures because if you made it through nursing school, you understood seizures. As far as a stroke or a brain attack or a cerebrovascular accident, we're going to cover strokes in a little bit of detail. So what happens, basically there's an infarcted area in the brain for whatever reason. There's a tumor, there's bleeding, vascular problems, plaque, regardless. The person has a stroke. And so usually when someone has a true stroke, they'll have neurological dysfunction lasting, lasting long. So they have disruption of the blood supply to the brain and infarct, and then, they'll have deficits from having the stroke. There are many risk factors to strokes, being older, depending on your diet, being African American, being male, having hypertension or diabetes if you're a smoker, sedentary lifestyle. If someone uses birth control pills, they're at higher risk for a stroke. Many different etiological or risk factors as to why someone could get a stroke. We are now noticing that strokes are happening in younger people. It used to be an elderly thing, we thought, but it now happens in a lot of different individuals. All right. What you'll assess as far as the manifestations of the stroke depends on where in the brain was affected. Primarily, keep the airway patent. We know that strokes can affect, for example, can affect vision, can cause weakness on one side of the body, can cause difficulty swallowing, can cause loss of speech or inability to write out speech, depending. So the term aphasia, you should get familiar with. Aphasia means speech impairment from injury to the brain. I think it's injury to the cerebral cortex, but for sure, injury to the brain. If it's expressive aphasia, the patient cannot say what they mean. So they try to say something, but it comes out with different words from what they really want to say. If we try to anticipate what they need, hopefully that will reduce frustration. If it is receptive aphasia, the patient is unable to understand written words. And so they may make up words. It's more difficult for them, so you have to give them very simple direction because they're not fully understanding our words. And then global aphasia, or if it's mixed, is a little bit of both. They both can't say what they mean and can't understand fully what you're saying. Other terms like agraphia is the inability to write. So there are a couple of terms that you want to be familiar with clients who have strokes. Now, as far as our interventions are going to match what is going on with the client. So if they have sensory and perceptual deficits, like if they have decreased proprioception. Proprioception means where the body is relative to space. Like right now, I'm sitting on a chair. They lose the awareness of their body position in space. So sometimes when they're walking, they'll hit their hips or their arms or different things because their sensory perception is off. They'll have visual deficits. So they'll only be able to see in one area of the visual field. And so if they have hemianopsia, you would remind the client to turn their head so that they see the complete visual field. Sometimes they'll have what we call unilateral neglect syndrome, where because they're not feeling one side of the body, they tend to neglect that area. So they'll lotion one side well, but probably not care as much for the other side. Remember that there's emotional aspects to getting a stroke. It could be a younger person. They may now have sexual difficulties, all of that type of a thing. There are many diagnostic tests that can rule out a stroke. Angiography, CT scan, MRIs, all of those things. Now, our interventions would include the airway. If it is immediate with the stroke, then some individuals will benefit from thrombolytic therapy, where they get drugs like alteplase that will split a clot. Of course, the TPA therapy has to begin within a certain time, and not every patient is a candidate for thrombolytic therapy. Other things like antihypertensive drugs, like anticoagulants are possible. Antiplatelet drugs are possible. Drugs for like spastic, the muscles getting spastic, like baclofen or other muscle relaxant types of drugs. And then, of course, clients will go to rehab programs depending on how much damage. Within the first 24 to 48 hours of a stroke, clients usually are on bed rest, and we wouldn't raise the head of the bed past 30 degrees. We're not trying to increase intracranial pressure. You want to have oxygen, you want to do frequent neurological checks, and you're always assessing the clients for falls, things like that. When you think of the stroke patient, think of complications of immobility. So someone had a stroke, so they can't get out of bed as easily. So you want to turn them every 2 hours. You want to fix their pillows, use sandbags or other those foam things to help support them. You always want to ensure that the person who had a stroke can still swallow well. So you have to be very careful, make sure they have a gag reflex. You'll get questions about things like foot drop. They can use high-top sneakers to prevent foot drop. You don't want the mattress tight on their toes. You know, all these different braces to prevent contractures. So just reminding you of what happens with a stroke patient. They'll ask you about things like slip-on shoes. They need loose pullover shirts. They don't want things with like a lot of buttons because they can't do them. They can't tie laces. If they talk about the patient having hemiplegia, right? They're going to ask you about nurse in the GA is feeding the client and the client has hemiplegia and the nurse knows to put the food which side of the client's mouth, right? Now, when you're reading questions and they have the affected side and the unaffected side, and it just can become like big words and they're blurring, you know, really think about it. If my left side of my mouth is weak, let's say, food is going to fall out of that side. So you would want to put the food on the unaffected side. So don't make the words trip you up because you kind of know it if you picture it. If they have impaired swallowing, things like that, they shouldn't get thin liquids. They would need thickened liquids, smaller bites. You teach them to chew the food thoroughly. You teach them not to drink the beverage while they're eating. If they ask you about interventions with the client with aphasia, when clients don't understand us, it doesn't really help if we shout. Don't choose the answers where the nurse knows to increase her voice and yell and things like that. You want answers like the nurse will face the patient, speak slowly and distinctly. You know, those types of options you should choose. And if they talk about neglect syndrome, just remember what I said. It's like the person will loach on the right foot but not loach on the left foot. So we remind them not to neglect one side of the body. Right, remember that some individuals do go to stroke rehab. Right, not trying to bore you to death.